Hello and welcome. My name is Ron Romano, and I've got Dr. Neil Baum on the telephone with me today. And we're going to have a bit of a webinar here on testimonials and patient conversion. And most people don't realize that testimonials are an integral part of converting website visitors to patients. Now, Dr. Neil Baum has been a very successful surgeon and a successful internet marketer. He uses his website well, knows how to implement marketing systems, and knows how to use testimonials. So welcome, Dr. Baum. How are you today?
I'm doing just fine. I'm very excited to communicate with you on this webinar on the use of testimonials.
Okay, now we both know that testimonials are a system, like just about everything else, and we have to implement systems if we are going to be successful. So, Neil, if you could tell us, why should you have testimonials in the first place?
Well, a doctor's reputation is one of the most valuable things that he or she can possess. We spend our whole lives protecting and nurturing our reputation. A doctor can talk about himself, but usually he's very uncomfortable doing it. It's far better to have other people talk about the physician. And consequently, testimonials is one of the easiest and best ways to accomplish this.
You know, you're absolutely correct, because people expect a doctor to say that they're the best or the most competent and that you should come to me because I can cure your problems. But we all know that what other people say about us is infinitely more powerful than what we can ever say about ourselves. And that's why referrals are always the best kind of business that you can get. Testimonials are basically that type of referral. Now, we all know that they're important, but how do we get them?
It's so easy, Ron. All you have to do is to ask your patients to create them. Every day, people are telling me how I changed their lives, how I cured their problem. And when they state that to me, I say, could you possibly put that in writing for me so I could put that on my web page? And it is so easy to pull out a sheet of paper and quote the patient, have them sign it, have them date it, and you've created your testimony. You don't have to ask them to do anything. You don't have to ask them to dial in. You don't have to ask them to go to any web pages. All you have to do is to get their permission. And every doctor hears this every day and has opportunities for 3 to 5 testimonials a day.
Okay, so you're saying that when you've got them in the office, right then and there, that's when you should get them in. You should write down exactly what you want them to say.
I'll give you an example. In my practice, I deal with very sensitive issues such as erectile dysfunction and incontinence. A woman says to me, you know, I was wearing diapers. I'm not using them any longer. Obviously, that can't be a testimonial. But when she says, you changed my life, then I get her to, I put it on the page, I write it out, Dr. Baum, you changed my life. Now, the important thing is that they can't just use their initials or say a satisfied patient. They have to commit to using their name and what city they're from in order to make it believable. AA, patient of Dr. Baum, is not as believable as John Doe, New Orleans.
Absolutely. You're absolutely correct on that. And most people feel that it's so hard to get that from the patient. But what you're telling me is, depending on how you word the testimonial, you know, they're going to feel very, very comfortable in giving you everything that you want to know.
I absolutely have found that in one of the specialties, most delicate areas of which I deal with, I very seldom have someone say, no, I don't want to put that up there. If you really changed their life, they're delighted to tell other people and share that. In years gone by, we called that word of mouth, Ron. Now we're calling it word of internet.
Wow. Now, you mentioned they'll put it on your website. Is this how we use them correctly, to put them on the website?
Well, that's certainly one place, you know, to use it and put it on a prominent location on the website. And I think maybe you can discuss what's the prominent location. But second, you also can put it on doctor reviews. And there are reviews, so many places where there are online reviews, and you can ask the patient. I give them a card with the online reviews for Google, Yahoo, Yelp, AskDoctor.com, Angie's List. You can give them the sites and ask them if they would go to it on their computer and then enter the testimonial. The reason is that 95, 98% of all online reviews are usually positive. There's usually one or two negative ones that go out there, and you want to balance that negative review with large numbers of positive ones, because if a negative review is out there all by itself, it looks terrible. But if there's 19 reviews out there saying you're the greatest thing since sliced bread, and one review says that there's a problem with the doctor or the office, it really goes into perspective, and the doctor comes out glowing.
You know, that's an excellent point. Most people don't even think about doing that, but you really have to lead the patient. You really have to lead that person to do what you want them to do. And on your website, when we did your website over, we put your testimonials in a very, very prominent position. You had them buried before. You had them on your website, but they were buried. Now, when you go to your website, it's right on the front page, and you've got video testimonials as well. But ideally, on a web page, you want the testimonials above the fold, and you want them on the first page. You want them either on the top left or top right of your website so people see them. If they're scrolling, that's fine. You should have a testimonial page. Testimonials should always be in italics. They should always have quotation marks. And if you can, get a headline for testimonials, because oftentimes if you have multiple testimonials, sometimes they're a little bit long, and the website surfer may not want to read through every single one of them, but he may skim the headlines. And if you can get a headline out of the testimonial, which is very easy to do, put a headline on the testimonial. That way, people can skim through them. They can see things that might be relevant to their particular situation, and that'll be a powerful referral, word of mouth, on your website. Dr. Baum, thank you very much for talking with us today. If anybody out there would like some help in organizing their website or finding out how to put conversion points on their website and how to convert existing patients to higher paying patients, just give us a call. Thank you so much, and we'll be talking to you again. It's Romano and Dr. Neil Baum. Bye-bye now.
Thank you. Bye.